Hello and welcome. I am so happy to be with you today as we explore together how to build wellness during these challenging times. My name is Mary Catherine Lundquist, and I work at the COPSA Institute for Alzheimer's disease and related disorders at Rutgers University Behavioral Healthcare. Thank you for joining us today. Let's take a minute to review our roadmap for this webinar. By the end of this session, we hope you will be able to recognize factors that cause stress during a pandemic, identify strategies for coping during a crisis, develop a protection plan for staying well, and explore resources for caregivers that can assist with overall wellness. Many of us have had major changes in our lives due to the current pandemic. We've all had to figure out how to get groceries and what activities we can safely do outside the house, and even the people we can see in our house. Those of us who continue to work outside the home may have new anxieties about the risk of getting sick and new responsibilities on the job. All of us have experienced disruptions in our usual habits and routines. Many of us are struggling with social isolation. We feel challenged physically, financially, and emotionally. These changes can be stressful. We know that taking care of a loved one can be very rewarding, but it can also create added strain that impacts our health and well being on top of all the new challenges we are facing. When we are trying to support others, it can be extra challenging to also support ourselves. Today, I will share some things we can do for our wellness, which will help build our resilience during these challenging times. We're all trying to make sense of how different our lives are now, and we're trying to gain a sense of normalcy in the current situation. Many of us probably feel like we've been forced to make changes and we had no choice. All of these are very valid feelings. Let's take a minute to check in with ourselves and see what has changed for me. Stop and think for a minute. Some things that other caregivers have mentioned include not being able to send their loved one to an adult day program, not being able to have family members come over and watch their loved one so they can go out and do things that they need to do for themselves. So, overall, a lack of respite care. Many caregivers report that the days seem longer and they go on and they never seem to end. Sleep patterns can be very different too. We're all trying to stay safe and keep our loved ones safe and stay ahead of the growing problems. Many caregivers report making lots of changes to meet the needs of their family members. Maybe you even have grown children or grandchildren who are in the home with you, and their needs might be quite different from your own. Plus, we all want to know, when will this end? When will my life go back to what it used to be? So, even though we all have unique circumstances, we also see that we have a lot in common in facing the current challenges. Let's review some information from the experts. Many people have been studying what we have been going through, and here are some of what they have found. Stress during an infectious disease outbreak can lead to fear and worry about your own health and the health of your loved ones. We may have changes in our sleep or eating patterns. Many of us may have difficulty sleeping or even concentrating throughout the day. We may have worsening of chronic health problems if we have something like diabetes or arthritis or heart conditions. We may have worsening of mental health conditions. If we suffer from depression or anxiety, those can be aggravated by the stresses we have with the pandemic. Also, many people can experience an increase in use of alcohol, tobacco, and other drugs, and even sometimes overeating or undereating in attempts to cope with the stresses that we are experiencing. Now that we know even what the experts are saying, let's take a closer look at stress and the relationship between stressors and stress. Stressors are situations or events that feel threatening, dangerous, or overwhelming. Stress is how you react to the stressors, either mentally, emotionally, and physically. Commonly, people experience stress as tension, strain, or feeling upset in some way. Stress is often a sense that the demands on you exceed the resources you have. For example, you are faced with a situation or expectation that you believe you can't handle because you don't have enough time, money, patience, or energy. We can all probably call to mind a recent time when we felt stress. We can't always avoid stressors, like the stressors we are experiencing with this pandemic, but we can often do something about how we react to the events, situations, and people in our lives. Let's pause and check in with ourselves. How do you know when you are stressed? For me, I often get a pain in my shoulder and a pain in my neck. What may it be for you? How do you know when you are stressed? We all have stress, and our body sends us messages letting us know that we are stressed. It's good that we can tune into these messages that we receive from our body. Let's talk about some tools we can use to help us manage. Let's review some simple strategies or tools that can help us build wellness as we care for ourselves while we are also caring for someone else. We won't develop all these skills in this short webinar. After all, it takes time to be a master builder. But whether we are an amateur, a professional, or an expert builder, the first thing we need is the right tools and strategies. We are going to review 5 tools. The first tool is to unplug. This tool has 2 pieces, pause and breathe. You can use them together or separately. Pause means just stopping what you're doing and really focusing your attention on your experience, your breath, your body sensations, and your emotional temperature. Pausing is focusing on the present moment without judging what should or should not be happening. Taking a short break to pause and breathe can help you relax, regain a sense of control, and reduce your stress level. Pausing also gives you a chance to check in with yourself so you know how you're feeling physically and emotionally. This helps you become more self-aware so you can recognize when you are stressed. Breathe means controlling your breathing in a way that calms your body and your mind. With regular practice, you will find it easier to calm yourself when you are tense and anxious. This improves your self-regulation and impulse control. Let's do a short practice together using pause and breathe. First, we will practice pause. To get ready, sit up straight in your chair. Stop what you're doing and check in. Relax. Become aware of the feelings in your body. If it feels right, close your eyes. Focus on your breath. Notice the sensations of your breath coming in and going out. Next, we will add a breathing practice. Breathe slowly and deeply in and out through your nose. Notice that your belly comes out when you breathe in and goes in when you breathe out. Your upper chest stays still. Now begin to lengthen your exhale. Let your breath out more slowly and more completely. Make your out breath longer than your in breath. Don't force it, just let your breath flow naturally. Keep breathing and relax. Breathe in, breathe out. Slowly bring your attention back and open your eyes. Refocus on how your body feels. Notice what's different about how your body feels now. How was your experience with the pause self-care practice? I love this practice because it doesn't take long. You can do it anytime or anywhere at any point in the midst of your caregiving and get a nice stress reduction experience. The second tool is mindful self-compassion. Mindfulness is both a practice, such as in mindfulness meditation, and a way of being in the world. Mindfulness means being in the present moment without judgment, not hashing over what happened earlier and not worrying about what will happen or what will not happen in the future. You may have heard the expression, be here now, from the late Baba Ram Dass. This is all about finding a place of quietness within ourselves. We have to be the calm eye in the center of the storm. We know as caregivers that we can have many storms every day. When you pause, you focus on your breath, the sounds around you, and the sensations in your body, like the feeling of your clothes and the chair under you. This is a mindful moment. You can also tap into a mindful moment when you go about your daily routines, habits, and activities. You can focus your awareness as you walk, eat, or do your everyday activities and chores. It may be something simple like pausing to smell the soap and feel the water as you wash your hands. And we know that we're all washing our hands a lot these days. It may be noticing the feeling of the soft, warm towels as they come out of the dryer. It could be taking a moment to really see the raindrops on the window, or the sun coming in the window, or the bright moon in the middle of the night. Mindfulness also includes fully experiencing your emotions, not judging them, not burying them and not exaggerating them, just noticing them and accepting them. We may be experiencing a variety of mixed emotions, from being stressed, scared, anxious, worried, or guilt. These are difficult times, and it is okay to have a range of emotions. There may be guilt of not being able to see your loved ones that depend on you, especially if they are in the hospital or in a long-term care facility. We may be worried about the care needs of our loved ones, or maybe anxious in our thoughts about how we're going to make it through. This time can be very stressful, scary, and unpredictable. People are losing loved ones to the virus and are unable to grieve as they normally would. It can feel like we have little control. Being aware of our sensations and our feelings will increase our awareness and our sense of control. Once we are calm and aware, we may be able to change our point of view and recognize choices where we didn't see them before. Mindfulness is a first step toward self-compassion, which is a special way of being kind and gentle with yourself. Self-compassion means being kind to yourself just as you would be kind to someone you care about who feels down or stressed. Be gentle with yourself and accept that you are not perfect. Nobody is. Remember that we all fall short from time to time. We all suffer. We all feel inadequate, especially in situations we can't control, fix, or escape. The third tool in our toolbox is positive thoughts. It's natural for people to dwell on the negative. Staying focused on the present can be hard because we all do tend to rethink the past and worry about the future. It can be helpful to replace negative thoughts with positive thoughts. This helps change your perspective and can help you feel more hopeful. A quick and easy way to do this is to remind yourself of your personal strengths, something you did well recently. Maybe you stayed patient in a difficult situation. Maybe you made someone laugh. Maybe you made yourself a nice meal. Stop and think for a moment about something that you did well recently. See, that only took a few seconds, but it can have a big payoff. Some people find it helpful to stop and think about their strengths and what went well today at the end of the day or right before they go to bed. Some people find it helpful when they notice they are engaged in a negative internal dialogue to counteract it by replacing it with thoughts about their strengths and accomplishments. It doesn't take much time and it can make a big difference. You have power over your mind, not outside events. Realize this and you will find strength. Part of caring for ourselves is noticing our thoughts and how we can change them to help us through trying times. We understand we had nothing to do with this new situation that we are in. We are also caring for people that we had nothing to do with the illnesses that our loved ones are experiencing right now. We can only do what's within our power, and that we know that we are facing this crisis together. Another type of positive thought is the affirmation. An affirmation is an uplifting and inspiring statement you can repeat throughout the day. To get started, you might think of a positive affirmation to remind you of your strengths. These might start with I am, I can, or I will. Let's try a few. Sit back and relax as I read you a few affirmations. I am enough. I can get through this. I am strong. I will thrive. How did that feel for you when you heard the affirmations? I know for myself, when I repeat an affirmation silently to myself, I feel uplifted and encouraged. I especially find them helpful when I am anxious or worried. When I repeat the affirmation, it makes the worry diminish and gives me a more positive, hopeful perspective. Maybe there is an affirmation you have used in the past. Let's stop for a moment and think about an affirmation that would be helpful for your life right now. We say the affirmation as if it is already true. When you are thinking about an affirmation, it is good to start the sentence with I am, I will, or I can. Let's pause for a moment and think of a personal affirmation. Very good. Hold on to that affirmation and make it a point to say it frequently. Note how you feel. We have yet another way to engage in positive thoughts, gratitude, reminding ourselves of what we are thankful for. You can use gratitude to tap into positive thoughts by thinking of something that went right in the last 24 hours. This can be something very basic and obvious, like you were able to get onto this webinar today, or you were able to get up and face the day. You might think of someone or something you are thankful for. It may be that we have a roof over our heads, food in the cupboards. We may be grateful for this chance to stop and take time to learn, replenish, and renew. Gratitude can happen in a passing thought, or it can be a more conscious practice. Some people like to keep a small notebook where they can list what they feel grateful for or record what they are grateful for, even on their telephone. When they are feeling down, they go back and read or listen to what they wrote earlier. So many ways to engage in positive thoughts. Let's pause for a moment and call to mind something we are grateful for. Very good. Hold on to that thought and repeat it to yourself throughout the day. Note how you feel. Yet one more way to increase positive thoughts is to savor the good moments. Have you ever recalled a positive experience you had? Maybe it was the time when you were at a family wedding. Maybe it was your first time learning how to ride a bike with your dad. Or maybe it was how you felt when you had a nice lunch with a dear friend. Research tells us when we recall these positive experiences during stressful situations, they become good coping mechanisms for us. When we recall the event, we are allowing ourselves to experience the emotional attachment of that event that can give us a sense of calm, relief, and the confidence to continue on during stressful experiences, just like the ones we are experiencing now. Savoring can increase our positive emotions, which in turn can relate to less depression and greater satisfaction in life. So think about a moment that you would like to savor. Wow, so many ways to engage in positive thoughts. We just reviewed focusing on our strengths, using affirmations, and practicing gratitude and savoring the moment. Lots of quick and easy ways for us to increase positive thoughts in our life, even in the midst of all the caregiving responsibilities that we have. I hope you'll find one from here that is useful for your life. Our fourth tool is building a supportive daily routine. We would all agree that our schedules have certainly changed, but keeping up some sense of routine can help us feel a sense of control over a stressful situation. Routines can help us deal with social isolation, and they can also help us feel more aware of our goals so we feel more accomplished. What are some things that you can do now to build a supportive routine for yourself? I know this is harder when we are caring for someone else, but when we make time to plan for our day, it can set us up for success with caregiving and self care as well. Do we schedule in time for us to eat, time for us to work, time to chat and connect with a friend on the phone? Time to unwind by watching a favorite TV show or doing a puzzle. Time to exercise, like take a walk, or time to connect with our spiritual supports. As caregivers, we are typically very good about doing everything for our loved one, but we leave important things for ourselves off of the daily schedule. Let's make it a point to put ourselves back on the schedule and make sure that we stay there. What are some things that you can schedule for yourself, for your own mental and physical health? Maybe these are things you had been doing that you stopped doing, or maybe things you would like to try to do. Some things that caregivers often mention are making it a point to connect with friends on the telephone. Many caregivers have canceled their own doctor's appointments because they're focusing on all the appointments needed to care for their loved one. So, keeping doctor's appointments for myself can be very important. Taking my medications. Sometimes, as caregivers, we're so busy during the day that we forget to take our own medications. Getting the exercise I need can be at the top of the list for many caregivers. Some of us may even have prescriptions for physical therapy, but we haven't been able to do it because of our caregiving responsibilities. And I think a big one for all caregivers is getting the respite I need. It's been much more challenging during these days to get those respite opportunities, but it's still good for us to try to do what we can to give ourselves time so we can add these important routines for our own physical and mental health back onto our daily schedules. One thing that can be useful for everyone is to go outside. A growing body of evidence suggests that people who engage in a short term visit to a park can experience physiological and psychological restorative benefits. Isn't that wonderful? We may not all be able to go to a park every day for a few hours, but what can we do to have a bit of exposure to nature every day? Maybe a 5-minute walk in the neighborhood, even every day, just walking out to get the mail at the mailbox can be helpful. or sitting on the front porch or under a tree in the backyard. Now that the weather is getting colder, we may need to wait until the middle of the day when it's sunny and maybe wear a coat, but it's worth a try. Even if you can't get outside, sitting by a window where the sun is shining through or throwing open the window to feel the fresh air can be very helpful. Having a few minutes to connect with nature can help us reduce our stress and recover from the fatigue we often experience as caregivers. Our fifth and last tool is to connect with social supports. Although we are all homebound now, we are finding new and inventive ways to stay connected with family and friends. In the beginning, for many of us, it was confusing and scary thinking about how we would still stay connected to loved ones when we couldn't see them. Thankfully, we've been finding creative ways to do that. Relationships give us the support we need to continue building resilience so we can push through adversity and increase our hope, which helps us know that we will be okay. An important part of relationships is knowing that it is okay to ask for help. Sometimes it may be difficult for us to ask for help, but now more than ever, we can draw on supports that can help us through these difficult situations. People sometimes think it is a sign of weakness to ask for help when it is actually a sign of strength and health. Support can come from many places, from friends, family, community workers, and even medical professionals. Support can also come in the form of a support group. Maybe you have had the chance to attend one and you have found it helpful. If anyone needs assistance finding a support group, know that myself and the staff at Care to Caregivers, as well as your support team at your local Office on Aging, are happy to help you find a group that is right for you. Some people prefer to talk one-on-one and find a personal counselor an excellent option. And some people find they benefit from both attending a support group and also seeing a counselor. Either way, we are here to help you connect with the supports you need. I am so glad that we have had the chance to review these 5 tools. Remember that protecting your wellness also helps you protect those you are caring for. Staying well is not only important for ourselves, but for the people around us as well. We all understand the need for planning. We've made plans that address various aspects of our lives, from school, purchasing a house, to going on vacation. Even when we go on vacation, we plan for the good weather and the bad weather. So too with our plan for ourselves. Thinking ahead and making a plan can set us up for success in managing the stresses of life. Planning when to unplug, when to engage in mindful self-compassion, when to build positive thoughts through the things that we discussed, thinking about our strengths, using affirmations, practicing gratitude, and savoring the moment. Planning when to build daily routines for ourselves, for our self-care, and when to connect with our social supports. Let's pause and take a moment so we can identify something from today that you can add to your personal wellness protection plan. Stop and think about something we have discussed that will be helpful for you in maintaining your wellness. Very good. It's great for you to identify at least one thing, and we have so many great suggestions in this presentation for you. What I love about all these things is that you don't have to leave your house. You don't need any special equipment. You just need yourself and you need your thinking, and we all have access to that. So, in addition to these things that we have talked about as we wrap up today, know that there are always more resources to support your quest for wellness. Here are a few. The New Jersey COVID-19 Information Hub is a great site to visit where you can get lots of up-to-date information on disease prevention, testing, and treatment. It's a great place to get the facts. And I know we're all getting lots of information from lots of sources these days, but this is an excellent, reliable source of information. Another reliable national resource on COVID can be found at the Centers for Disease Control and Prevention. And everyone will get a copy of these slides as well. So you'll have these addresses so you can look them up on your own and take your time looking over the websites. If you want to find out more about the mindfulness practices that we discussed today, Insight Timer is an excellent option. It is a free app you can download on your phone so you can engage in simple meditations throughout your day or night. Another great mindfulness resource is the UCLA Mindfulness Awareness Research Center. These are all free. You don't have to leave your house, and they will help you further develop the skills we have reviewed today. Here's something we can all use: assistance with increasing our self compassion. This means giving ourselves the same love and kindness and tenderness that we show to those we care about. Check it out at selfcompassion.org. For assistance in locating a counselor, you can visit the American Psychological Association website. Remember also that myself, the staff at Care to Caregivers, and your support team at your local Office on Aging can help you find counselors in your area too. And finally, if you're looking to just take a break and unwind, there's lots of great resources on the web. Check out the Tiny Desk concerts at NPR. It's a great way to get away and unwind, even when you can't leave the house. Lastly, please know that the staff at Care to Caregivers is here to support you with all aspects of your caregiving journey. From figuring out how to convince your loved one to take a bath or change their clothes, finding help in the home, or just being a listening ear so you can vent about your day. In these unprecedented times, it helps to know that you have a support team on your side. Know that we at Care to Caregivers, along with the wonderful support team that you have at your local Office on Aging, are here to support you every step of the way. Thank you for being here today, and thank you for taking time for yourself.